Right, everybody, I'm going to review the pharmacology quiz 2, okay? So I just posted a study guide on Canvas, so I believe you guys all receive it. So this is the reviewing for the quiz 2. So the number one, liver toxicity medication. So this is 4 medication here, so it should not be that so difficult. I already give the medication. You should know, even you can Google or ask AI which medication actually is liver toxicity, okay? Number two, the liver failure medication will the same. So all this medication, what medication actually will cause the liver have some kind of toxicity problem? Remember, lots of medication actually will cause the liver toxicity, right? So I give you all the PowerPoint slide there. So remember, just put it down, okay, and just try to read it. Isoniazid medication possible side effect need to report. So which medication is isoniazid? INH. This medication is for the TB, for the patient have a TB medication. Remember all the TB medication, we have like two huge concern, right? So for the liver failure and also nausea and vomiting. So possible side effect based on these two have some kind of side effect. Which one you feel like you need to report? Okay, just go to see the sign and symptom. So sign and symptom is your answer. Number four, so the client has like a food poison, but no receipt of hepatitis vaccine. So what's your intervention? So usually for the food poison, it's the fetal to oral infection, and this is kind of hepatitis A or E, right? These two, so two hepatitis. But the problem is, so the client just never received a hepatitis vaccine. So usually the vaccine we have is for the hepatitis A and B. So if he never received a hepatitis A vaccine, but now he does have some kind of concern, maybe he will get a hepatitis A. So what's your nursing intervention? Well, the medical intervention, I should say that. So what kind of a medicine, what kind of injection you should give it to him? Okay, you should give it to him. Remember that we have this in our midterm already, so it's very similar answer. Number five, hepatic encephalopathy. Receive lactulose, the sign of improvement. So why we need to give this medication to the patient? They have this kind of like a hepatic problem because the ammonia level is high. So that's why we want a patient to pull and pull out with all the ammonia. So that means what? That means that after the patient just decreases the ammonia, what is the sign of a symptom or improvement? Yeah, of improvement. So just go to see the sign and symptom. Okay, the sign and symptom is telling you actually your patient is getting better right now. Number six, pancrealipase enzyme is taken with a meal in education. So this is an enzyme for the pancreatitis, okay, especially for the chronic pancreatitis. The patient is lack of enzyme because the pancreas is having some kind of inflammation. So that's why the patient need to take the enzyme. So when we're taking the enzyme, so with a meal, so what's how you take it with the meal? So how you take it with the meal? So do you take this enzyme before or during the meal or after? Is that okay taking after the meal? So for how long we should take it with the enzyme together? So also with the meal, so we just take it with the meal or either even we just take it with a snack food. Do you think that taking the snack food will also need to take this enzyme? So this is all will be the answer, okay? Go to see the answer, you will find out the answer is there. It's not that hard. Just thinking about how can we take it with the meal. Number seven, encephalopathy. So further education over treatment. So this is kind of like a liver failure will increasing that of ammonia level. That's why patient get confused, right? So I guess the patient is discharged right now. So when they going home, so for you to get education and also further treatment. So do you think the patient still can drink? Like even social drink, like an occasional drinking, is this okay? So what kind of vitamin usually the patient need to take? So remember this is certain of a liver failure. Okay, so certain of liver failure. So the patient need to take some kind of like a special vitamin. Something very special vitamin. So you can Google AI. So remember we learned this vitamin and we also learned this kind of withdrawal symptom from our site from like mental health. So the mental health, we do have like one chapter is talking about, okay, the patient, if they do have some kind of liver failure because they are drinking too much alcohol, like alcoholism. So that's why they will have a withdrawal symptom. That's why they need to take some special vitamin. So what is that? Okay, number 8. Rifaximin, so to treat encephalopathy. So what should we aware? Okay, what should we aware? So when we taking this medication, we treat the ammonia level is high. So we want to kill some kind of bacteria, especially the E. coli. Okay, and just kill it in our intestine, in a colon area. So that's why it's not going to produce lots of ammonia. But here is a problem. So this medication will kill most of the bacteria, right? So when we kill whole bacteria in the colon, so what should we avoid? What will happen like after that? So you need to know, okay, so that would be something wrong about that. So this is the kind of Simon syndrome. The Simon syndrome is telling you, okay, so when you take this medication and will cause some kind of complication already. So remember, the Simon syndrome, you need to be aware with that Simon syndrome is telling you that kind of like an infection. All right, number 9, Kepra education. So when the patient taking the Kepra, this medication, so how they taking it? Okay, so what is the medication for? This medication actually is for the anti-seizure medication, especially for the people they have a liver failure. So when the patient just have a liver failure and they cannot metabolic with waste product very well, so it will cause the ammonia is high. So that's why ammonia level is high will trigger patient seizure. That's why we're taking this medication to prevent the seizure. But when we're taking this medication, what kind of education you think about you need to tell the patient? All right, number 10. So when we give an IV for the pre-operative sedation is already given. So how can we just ensure patient safety? That means what? You already give a sedated for the patient already. So for some kind of patient safety, so do you think you need to pull out the side rear? Do you think you can just let the patient get up to walking around? Do you think maybe just put the patient in like a nice area and with frequent orientation is important? Do you think you need somebody stay with the patient? Because the patient maybe will get confused or have like a delirium. Okay, and maybe they will try to get out, or maybe they kind of get yelling and shouting. Do you think it's a good idea maybe have like somebody or a family member stay with the patient for a while? Okay, think about this. Okay, that will be the answer. All right, 11. Polypharmacy before the surgery, your intervention. Do you think about you should ignore the patient have a polypharmacy issue, or you need to file a report to the doctor? Hey, this patient have lots of medication, is taking lots of medication, and some medication is a huge concern. We probably need to investigate, asking the patient, okay, when is the last time you take all this medication? Because some medication have an interaction, right? We interact with your anesthesia medication, and also especially it's kind of like an anticoagulant will cause bleeding episode. So just go and check. Okay, so the answer is how can you just thinking about is a safety polypharmacy nursing intervention? That will be the answer. Okay, safe for a patient when the patient have polypharmacy. 12. So the skin preparation and allergy before the surgery and your intervention. So remember, before the surgery, we need to do some kind of skin prep for the patient, right? We use it like a big wand, like an iodine wand, and to scrub the patient's skin very very well. But now the patient is telling you, okay, I do have some allergy, like a seafood allergy and also dye allergy. So what's your intervention? Do you think about we still do it? I don't care, no matter what. Okay, do you think about, okay, you need to tell the doctor, and also which is use another medication? What's your nursing intervention? Do you think it's okay we use it? We use this kind of iodine preparation. Okay. Number 13, prevent the blood clotting is the beta action. So do you think only medication? Remember, so the blood clotting, the beta prevention. Remember the PowerPoint slide I show you like a 1, 2, 3. So the number 1, it should be the early ambulation, right? And the number 2, it should be some kind of like device. For example, like a SCD machine or a tech horse. right? Take horse, that's stacking. And then number three, we use the medication, right, like anticoagulant. So that's why, do you think the only medication will work? So do you want to pick a medication as the first priority? So be careful of this answer, okay? Number 14, patient received extra opiate dosage, so and is already experienced a mild sedation and your intervention. So this patient is kind of like a mild sedation already. Okay, so what's your intervention? Do you think it's okay, just like before, a patient can just get up, or like a patient just can do some kind of like a daily activity? Do you think that's kind of like a safe for the patient? And the patient is already mild sedated. So what would you do? Do you think that mild sedated and we should just get a Narcan right away? Is that necessary? Okay, so this question, remember, we just also have it like a very similar in the midterm. Okay, very similar. So that's why it's not going to be difficult. Just another practice again. Just see your answer. The answer actually is not complicated. Okay, so do you think the mild sedation, these things, what should we do? Do you still want to give extra medication, even it's mild sedation? All right, 15. Can the mother make a decision for the adolescent how to use a PCA pump? All right, so we know the adolescent or the kids they're kind of minor, so that's why they do have some kind of like a how I say that, so like a custody or the parents is going to be the power of attorney and making a decision for them, right? But do you think it is about for some kind of medical decision? So the parent is always making a decision for them. Do you think that these kids, okay, they do have a right can make their own decision? So remember the PCA pump, that PowerPoint slide, we say something very important. Do you think it is about mother can make a decision for her kids? So how much dosage the kids should be used? So how much painful then the kid can use the PCA pump? And do you think the mother should just push the PCA pump for her kids? Yes or no? Okay, think about this. Do you think this is legal or this is a good ethical? 16. Warfarin should be whole for how long before the surgery? Okay, this is just like the number. Okay, how many hours, how many days? Okay, remember what I told you. Okay, what I told you. So that's why I just pick the number. So 17. Patient is having a PE symptom, like a pulmonary embolism symptom, after surgery right now. So your first intervention will be what? Okay, so I know you want to do the assessment. Okay, so assessment is not in this question. So just pretend we did the assessment already. So what's your first intervention? Do you want to give some oxygen first? Or do you feel like, okay, the PE, we should give some heparin right now? Or do you feel like, okay, PE, we should call the rapid response right now? Or do you think about we just want to do the EKG or just draw some blood right now? Okay, so all of these four answers, they all the correct answer. They all the correct answer, but you need to pick the one is the first thing you should do. The first thing, just do it, and then you will do the second one. So which one is your first intervention? These four, which one should be the first one you do it? 18. After receiving the Narcan, because the opiate induced a respiratory depression, okay, so what intervention later? That means what? After you give the Narcan, so what would you do later? So can you discharge a patient just going home? Even you get a Narcan, oh, that's fine, I give a Narcan, patient is safe, so just go home. Do you feel like you need to do some more assess and also monitor even after you give Narcan? Even the patient is safe right now. Okay, the patient is a little away right now. Do you feel like you still need to monitor or assess the patient? And also, do you feel like, okay, you want to cut the pen dosage for the patient? Because the patient was like a respiratory depression, maybe it's an overdose with the opiate. So that's why you want to decide to cut the patient doses right now. Do you feel like you can stop giving all the pain medication for the patient? Okay, because you feel like maybe it's not safe. Okay, let's not give the pain medication anymore. Let's hold it for all the pain medication. Okay, remember this is a surgical patient. They're gonna have a pain. Is that a good idea? I hold all the pain medication right now. All right, and also hold all the pain medication. It doesn't mean the pain medication have to be opiate medication. It could be have a breakthrough pain medication. Some breakthrough medication is not opiate medication, but is that a good idea to hold it? All right, 19. Post-operative hypotensive intervention. Okay, so that means what? Patient have like a blood pressure is high after the surgery. So what's your intervention? So I give you a very strong hint here. So usually, why is the reason blood pressure is high after the surgery? Remember the PowerPoint slide we talk about this, we discussed, right? With all the vital signs, high and low, high and low. So this is happening again. So after the surgery, so the blood pressure went high, right? The blood pressure went high. So usually, what's the reason cause the blood pressure went high? There's several reasons, right? Several reasons. So that's why we are telling you, okay. So when the patient have a hypertension, and what's your intervention? What should you need to do for this kind of thing? Remember, in the midterm we practice is a blood loss, right? So this time, so do you think it's also only a blood loss is your intervention, or maybe have some other reason also will cause the hypertensive? 20. Patient discharged with the antibiotic. So when can the patient decide to stop the antibiotic? So do you thinking about a patient will make their own decision? Okay, I should stop the antibiotic right now. Okay, do you think this is a good idea? Okay, this is a very easy and nice, easy and simple question we learned before. Okay, it's not complicated, so that's why I'm just trick you. Okay, I'm trying to trick you. Do you think the patient just tell you, okay, so I discharge and my symptoms is better right now, so I'm just decide to start my antibiotic? Do you think this is a good idea? Okay, so this is 20 question. Okay, so just go through. Some is in your PowerPoint. Is a severe answer, obvious answers there. So some maybe you probably need to Google it or AI it and just use your critical thinking. You'll get the answer. Okay, thank you and good luck.